probably the hardest stuff next to the ABO blood typing. So I'm going to go fairly slow with this for the next half an hour or so. Platelets. Remember, they are not a true cell. They're a fragment off of a gigantic cell. That gigantic cell is called a megakaryocyte. You take a plate, smash it on the ground, you take a piece, that's a plate. The plate was the megakaryocyte. There's granules in there also, and the granules have a few different things we'll talk about throughout the course. But the function of platelets is the first line of this complicated clotting system. If there's a motor vehicle accident on the highway, the first people to get there are the paramedics. These are the paramedics. They're not going to save the whole situation, but it's going to keep it in a stable position until we can get something more permanent. They're our first line to get over there. So it forms this, what we call temporary platelet plug, that seals things. So that, yes, there's two reasons for them. One, you don't want your blood pressure to go down by all this blood that's coming out, so it's going to seal it. But if you have an opening, a blood vessel that is open now, you're also opening a window so that bacteria can come from the outside and going in. So it's doing two things. It's stopping your bleeding, and it's going to put this temporary wall so that bacteria can't get into your bloodstream. All right? So again, you got this hemocytoblast, our stem cell. It goes through a number of stages, and I want you to basically know the megakaryocyte. And from the megakaryocyte, things break off, and those are your platelets. Okay? Now, hemostasis. It's this whole long cascade of events that occur when you cut yourself. How does your blood stop from coming out of your body? It's called hemostasis. And we have three major things going on. First off, you're going to have this vasospasm, which is not going to be so great, but it does something. It's going to make the blood vessel, when it breaks, it's going to spasm a little bit, almost causing a vasoconstriction so less blood flow happens there. If you want to talk about a motor vehicle accident, you see it right in front of you. What does the rest of the cars around the area do? They stop so that we don't have further motor vehicle accidents. That's what's happening here. Can you still have a motor vehicle accident if you stop? Sure, people will stop in front of you. It's not the best thing, but yes, it will do something. So you have this vasospasm, and it's due to a number of different things, thromboboxanes that come from the platelets, and also from the damaged endothelial tissue of the blood vessels. They release something called endothelin. Once that vasospasm occurs, the next thing that's going to happen is the platelets are going to go to that area. They become sticky and adhere to torn blood vessels. And that's what's going to happen there. There are paramedics. And once they form this clot over there, this blood clot, or platelet plug, we'll call it. It's not really a clot yet. It's a platelet plug. It actually sends off other messages to get more platelets there to get to the area. So these are our paramedics. Once the platelet plug is there, then we got to put some permanent glue there. And that permanent glue is called fibrin. To make fibrin, it's a long cascade of events that occur, called the coagulation steps. And we have a lot of factors in there. So what happens here is this. You have a blood vessel here, it breaks. Vasospasm occurs, and it kind of slows down the amount of blood to get to that area. It's not the best thing, but it's something happens. Then you're going to have these white things over here, the platelets, and forming a platelet plug. Sure, if you touch over here, the platelet plug is not going to be that strong, and blood will happen again. You know what I'm talking about, right? You cut yourself, slows down, but if you tap it more, blood starts coming up. It's not the best. It's a temporary plug until this yellow stuff starts to build up in there, and that's called fibrin, and then it's going to make it more solid until the blood vessel can repair itself. So you have this platelet plug, and normally the platelets don't stick together. But where there's a broken blood vessel, they will stick there. Okay? So once the blood vessel endothelium is exposing itself, all right, the torn area, now the platelets are going to bind there. But before they bind there, there's something that goes on there called von Willebrand factors. Von Willebrand factors are going to attach to these areas, and platelets will then attach to the von Willebrand factors. This is stimulated by thromboxane. These are chemicals that will stimulate things to occur. We also have a release of something called serotonin and ATP. Serotonin acts as a vasoconstrictor, again, to allow less blood to go to that area. The ADP is going to get more platelets to that area also. Okay? So what's going to happen here, those blue things are platelets. You tore a blood vessel over here. The first thing that's going to go to the blood vessel that's broken are these black little spikes that go in. Those are your von Willebrand factors. Once you have those little spikes in there, now the platelets can bind to those areas. And once they bind over here, then these platelets are going to get more platelets. You don't need von Willebrands in between the platelets. You only need it at the place where it got torn. And yes, there is a disease that's called von Willebrand's disease. And that means you can't produce those von Willebrand factors. And guess what the manifestation is if you have von Willebrand's disease? You can't stop bleeding. So they have to put, we have ways that we can actually give you von Willebrand's factors through an IV. They do it, my guess is once a year or so to people who have this. All right? So again, you have this injured blood vessel. Von Willebrand's factor goes inside there, and that's going to get platelets binding to it. Then this platelet is going to release chemicals to get more platelets to the area, and you're going to get this platelet plug, which is a temporary measure. Okay? Now let's talk about the bigger issue, coagulation. Now you've got this platelet plug there, temporary plug, but you've got to get the glue in there, the fibrin. There's a whole chain of events that occurs with this, and they have numbers to them. So coagulation is a series of chain of reactions that we have many clotting factors coming in there, and they have Roman numerals with them. I'll show you that. All these clotting factors are made in the liver. And you need the clotting factors to stop the bleeding. So, again, applying the material. If you have liver disease, why would you tend to bleed more? What can't you make? Come on, people. Well, the clotting factors, right? Clotting factors are coming from the liver. You don't have your liver, it's destroying, whether you got cirrhosis of the liver, hepatitis, you're going to tend to bleed more. This is where you're going to be working in the hospitals, and you have a lot of responsibility as a nurse or a radiologist. You know that someone's got some sort of liver disease. It says it right on the person's chart, and yet when you try to put him on the stretcher, or you try to put him on the CT scan, he falls off. Hey, he lost balance and falls off. He's bleeding. Oh, he's bleeding a little bit. The guy has liver disease. He's going to be bleeding a lot. You've got a lot of responsibility to take on. Do you understand how to put this stuff together? How it's reality? Just becoming a nurse, hey, that's a great, job security. It's a great responsibility and all, but it's a responsibility. You're going out there and you got to be helping people if they fall down. It's not just punching in and punching out. You got to use the noggin of yours. Person's got cirrhosis, falls down. You're concerned that that person's going to be bleeding a lot more than usual. The hell with a CT scan, you better make sure he's not bleeding to death. That's the way you have to think. You may be doing this all by yourself at 3 o'clock in the morning. as a radiologist going up there. That's what you're concerned about. A lot of responsibility going into the medical field. You've got to think this way. It's not just punching in and punching out. It's not about a multiple choice test. You've got to apply this stuff. There's two pathways to do this. We call it the extrinsic pathway and the intrinsic pathway. And basically, it kind of looks like, I kind of draw it, and you see it a lot as a letter Y, where we have the extrinsic pathway here and the intrinsic here, leading to a common pathway here. And I'll show you what I mean by that. The common pathway is going to be the same. And there's 3 steps in the common pathway. Let me just verbalize it here. It'll make more sense when I show you the diagram. Prothrombin activator, also known as prothrombinase. And by the way, if it has the word or the last letters ASE, that's an enzyme. Always, no matter what. All right? ATPase, kinase, these are all amylase, lipase. If they end with ASE, it's an enzyme. So this prothrombinase is made, and then this prothrombinase is then going to convert prothrombin into thrombin. Once a thrombin is made, it's going to convert fibrinogen into fibrin, and that's your magic glue that is going to make the clot. It's the fibrin mesh. If you see the prefix pro, that means an inactivated form. If you see the suffix ogin, that's an inactivated form. And you see that a lot through A&P1 and 2. Pepsinogen becomes pepsin. All right, you learned about that with the digestive system. Sorry, it's all these different steps. Can't blame that one on me. But there's a lot of steps to all these things. So what's going to happen here is this. You've got a blood vessel here that's broken, right? There's a cross-section of blood vessel. There's inside the lumen of the blood vessel. The blood vessel breaks for whatever reason. So you're going to have platelets that are going to be forming over there. I think that's probably the blue stuff. So the blue, you see the platelets are forming. So it's forming a platelet flow. But that's only temporary. So it's got to go through the intrinsic and extrinsic pathways to get to the common pathway. The common pathway is this. It makes the prothrombin activator. This prothrombin activator converts prothrombin into thrombin. Thrombin is then used to make fibrinogen become fibrin. Now this fibrin, which is yellow, can be put in as glue into the platelet plug. And now it's more permanent, at least for the next few days, until the wound healing takes place. That's basically what fibrin is. It's glue, so to say. Now it's very busy. I think this is what's in your textbook. It's very busy, the two different extrinsic and intrinsic. All right? This is intrinsic pathway. Here's the extrinsic pathway, leading to the common pathway. Very busy. Do you need to know the factors? Yes. Do you need to know them in order? Yes. So just come up with some sort of mnemonic. You need to know it. Okay? Now some of the factors, most of them also have different names. For instance, factor 9 is referred to as Christmas factor. Not because of the holiday, but for the person who discovered it. You don't have to worry about the names of them. The numbers you do, though. Because that's the way of your life and your medical career. You're missing factor 8. You're missing factor 9. You need to know if that's the extrinsic or intrinsic pathway. They don't go in order. They go in order when they were discovered. This is more simplified for you. Again, extrinsic pathways here. And there's only 3 places that they actually use Roman numerals in life. One is here, with the clotting factors. The other one is the cranial nerves, which you learned in A&P1. And the only other time, which is probably the most important, is in February when you have the Super Bowl. Okay? Those are really the only times I think that it's pretty important to know Roman numerals. But this is going from, that's factor 7 to 10 to calcium to 5. They don't go in order as what you think by numbers, they go in order of how they were discovered. Okay? So if this looks too busy for you because you can't deal with the Roman numerals, make your life a little bit easier and put the real numbers right next to it in your studies. In my lecture exams, it'll be the Roman numerals, so that's okay. Cross off the Roman numeral, put the real number there so it's easier for you to manage that question. It's okay. Who cares? The extrinsic is shorter than the intrinsic. Intrinsic goes from 12 to 11, 9, 8, 10, 5. But look at this. The 10 and the 5, the 10 and the 5. So that's really part of the common pathway. To get it even more simplified is that. 7 goes to 10. Starting at 10, that's where the common pathway begins. Going from 12 to 11 to 9 to 8. If you're missing 8, we call that hemophilia. You've heard of hemophilia, even back in high school days. A bleeding disorder. You're missing that. So therefore, it can't go from 9 to 10 because you're missing that. They tend to bleed. That's hemophilia A. Hemophilia B is that you're missing factor 9. It's not as severe because it does a lot of, this will lead to, there's a lot of, a network that actually, like this will stimulate something down here. But this one doesn't really stimulate much. You don't have to worry so much about that. But that's what hemophilia is that we're missing a factor, a clotting factor. Where do all these clotting factors, where are they made? Where are they made from? What organ? The liver. You have liver disease, you can't make these. You will bleed. Okay? But when you get down, let me get back to here. So when you get down to, so it goes 10 to 5, that will make the prothrombin activated. Once this is made, it's going to turn prothrombin into thrombin. Once this is made, thrombin will make fibrinogen become fibrin, and fibrin is the final thing. That's what's going to make the glue. Now, all your clotting factors are made in the liver, but there are 4 clotting factors that are still made by the liver, but need a certain vitamin to be made, vitamin K. Vitamin K is needed to make clotting factors 2, 7, 9, and 10. They're also used to make clotting factors 9, 10, 7, and 2. And also 2, 9, 7, and 10, and 10, 7, 2, and 9. What I'm trying to say here is hint, hint, better know those 4 numbers. All the clotting factors are made in the liver. These particular ones are still made in the liver, but they need vitamin K. If you're low on diet and you're low with vitamin K in your diet, you're not going to make these clotting factors, which means you're going to tend to bleed. That's how you do it. Don't memorize things. Understand how and why this stuff is important. Someone's not taking enough vitamin K, they're bleeding. Why? Because they can't make these clotting factors. All right? You also need calcium, which is also factor 4, by the way. So yes, calcium has a lot of things that's important. We all learned from kindergarten that calcium is important to make bones strong and teeth strong. But that's down on the bottom of the list, as I've told you. It's more important with nerve conduction and muscle contraction, and now with clotting. Okay? So you need this. Okay? So maybe the clotting factors, or the clotting, may be initiated by the extrinsic factor, or the extrinsic pathway, or the intrinsic pathway. But in most people, they're both working at the same time, and when they work at the same time, it happens more efficiently and faster. But they will both lead to factor 10. That's the beginning of our common pathway. Okay? Factor 10 will then will actually stimulate factor 5, or B, and then factor 5 is going to make prothrombin. You know how Julius Caesar, you know how he orders 5 beers? Think about it. All right. Extrinsic factor, or extrinsic pathway, okay, begins with chemicals outside the blood. So it's going to happen from materials or chemicals that come from the broken blood vessels. That's outside the blood. That's why we call it the extrinsic factor, or extrinsic pathway. So what happens here in the extrinsic pathway, the damaged tissues release tissue factor, factor 3, okay? And when calcium is present, it forms a complex with factor 7. This will lead to factor 10. Hey, there you go, the common pathway. Factor 10 is where the common pathway begins. Factor 10 is then going to make prothrombinase, okay? And then prothrombin becomes thrombin, and then the thrombin will actually stimulate the fibrinogen to become fibrin, okay? And factor 8 also stabilizes that fibrin also. The intrinsic pathway begins with chemicals that are part of the blood, not from the tissues, but from the blood itself. Platelets release inactivated factor 12, and that's what starts the whole cascade of events that happens on this wing, or this pathway. 12 goes to 11, 11 goes to 9, 9 goes to 8, bam, you just got yourself to 10, the common pathway. Stages 2 and 3 are going to be the same. All right, prothrombinase to thrombin to fibrin. So this is just an overview or summary. Here's all the factors over here in Roman numerals. These are the names, the synonyms that I gave you. For instance, I kind of showed you before where factor 9 is also known as Christmas factor. You don't have to worry about the names, at least for my class, these names over here. But it also will tell you the description and the function of what that is. Okay? So how do you control clot formation? We have natural anticoagulants. We have something called antithrombin 3. And that's produced by the liver, and it slowly inactivates thrombin. You don't want it fast. It just formed the clot. You need it to go slower. We also have our bodies produce something called heparin. We talked about that because that also comes out where the basophils are. You've probably heard of heparin, people getting heparin in the hospital and stuff. Well, that's synthetic heparin, but our bodies do produce heparin also. And that's going to increase the effectiveness of this antithrombin 3. All right? So it could happen much faster with that. We also have prostacyclin. That's one of these, it's in a family called prostaglandins, which we're going to talk about. They have a lot of different types of prostaglandins, a lot of different functions of prostaglandins. There's these chemicals that do all that. Well, one of the prostaglandins is called prostacyclin. And this will cause vasodilation and will inhibit the release of clotting factors from the platelets. I'm sorry, the coagulating factors from the platelets. Questions? No, it depends on where the hemorrhaging is. You mean if you cut your arm over here and the blood just comes? No, because it's coming out too fast. Because the blood pressure is so strong, you can't do anything. The only thing you can do is a physical thing by putting pressure on the blood vessel itself. But there isn't a magic substance you give them if they're just hemorrhaging out there. Blood is just coming out of their mouth. You can't stop that. Okay? Again, it depends on how fast it is. The best thing is just put pressure on it until you can figure out where until you can sew up the place, whatever you have to do. Okay? Now, how do you break up the fibrin? So we call it fibrinolysis. Lysis means to break up. So we have this clot retraction. The clot itself, over a number of days, it's going to retract and get smaller and pull away from the blood vessel, or from the broken blood vessel. Okay? And that's going to pull it over there. And it pulls the edges of the wounds together to help with the healing process also. There's something called serum. Serum is plasma without the clotting factors, including fibrinogen. Okay? So when I say the difference between plasma and serum, plasma has clotting factors. It will clot. Serum won't clot. We also have plasmin, and it's an enzyme that will hydrolyze fiber, help break it down. Now, plasmin is an activated form. It comes from plasminogen, and plasminogen is going to be activated usually a few days after the clot forms to help break it down. All right? So this plasminogen forms into plasmin, and the plasmin is going to dissolve the fibrin after a few days, which is what you expect. You don't want the clot to stay there forever. All right? So plasmin breaks up a clot. Fibrin makes the clot. So repair of a torn blood vessel, you have these things over here, which I really don't want to get into because you learned about wound healing in AMP1 with the skin and stuff. But you have these factors over here where fibroblasts are going to form and make the collagen form over there to make the connective tissue patch. Now, a couple of hemostatic diseases, a thrombus, a clot. A thrombus is a clot that forms in an unbroken blood vessel. Okay? Usually we see that in the legs. You've heard of people having a clot in their legs. That's what we call a deep vein thrombosis, or DVT. They're in the car for about 5 hours not taking a break. They're on a plane trip from here to England for 5 hours. They didn't get up to walk to try and push that. If your blood starts getting thicker in your legs, it kind of pushes the blood up. If you just sit there with not moving them, the blood is going to stagnate down in your legs and form a clot. When it does, in your legs, it will shoot from your legs, go through the vena cava into the heart, and will be lodged into the lungs. When that clot breaks off, it is now not known as a thrombus, but now called an embolus. And when the embolus breaks off from the leg, the first place it's going to hit, because all the blood vessels here are pretty big. They get bigger and bigger and bigger as you get to the heart, the veins. But then from the heart, they get small, the blood vessels get smaller and smaller and smaller. So the first place it's going to hit is the lungs. And this is a medical emergency should someone get a blood clot to the lungs. We call it a pulmonary embolus, because now part of their lungs is not going to get that oxygen. You're not going to have the pulmonary embolus, because now part of their lungs is not going to get that oxygen. You're not going to have the blood oxygen mixture happening. So, like I said, an embolus is life-threatening. If it goes into the lungs, you're not going to breathe properly. Your heart can also create emboli, and it can go into your brain, and that can cause a stroke also. So prevention of undesirable clots, we have medications that we can do that. Aspirin. Aspirin is a medication. Let me just finish up here and I'll answer questions. Aspirin is a medication that you all know. It's one of the oldest medications that is still in existence. It's probably the oldest medication that's out there that we still use. And it has anti-prostaglandin properties. In other words, aspirin is a prostaglandin inhibitor. And what is it going to do? It's going to make sure that the platelets don't stick together. Because as you get older, after 55 years old and older, the platelets become stickier. They're not supposed to, but they do. And they get stickier, and this can lead to a blood clot in the coronary arteries. So people over 55 years old and more, they get an aspirin a day, a baby aspirin a day, to prevent the platelets from getting sticky and causing a myocardial infarction. Okay? So hint, understand the mechanism of aspirin. We could also give heparin, and I already explained to you what heparin is. We could give heparin that way. Warfarin, also known as coumarin. This is going to compete with vitamin K. Vitamin K is needed to make clotting factors, what numbers? Yeah, 2, 7, 9, and 10. So what's going to happen with warfarin, or coumarin, same thing, this is going to not make 2, 7, 9, and 10, which means it's going to not create a clot because of that. You may have warfarin in your cabinets at home. It goes under a different name called rat poison. And that's basically what it is. The rat eats the warfarin and it bleeds to death. That's how that works. And warfarin is given by mouth. Heparin has to be given by subcutaneous or by IV. What's the treatment if someone takes too much warfarin, someone poison control? They take warfarin and they're eating it, rat poison. What do you think is going to be the antidote for that? If it competes with vitamin K, what do you think you're going to give that person? Vitamin K. Hopefully, it'll overwhelm that rat poison and the vitamin K will win. All right? That's how you got to be thinking about this stuff instead of memorizing. Okay? You could have low levels of platelets. We call it thrombocytopenia. Okay? And you could guess what that will happen. All right? Liver disease, we already talked about that. How that can lead to bleeding disorders. And vitamin K deficiency, you've seen that too. Hemophilias, we mentioned a few of those already. It's when one of those clotting factors occur. Okay? Coagulation blood test, really not going to, it's an FYI kind of stuff. I'm not going to ask you about these, but if you had questions about PTT, PT, that's what that's all about. So don't want to go into that. All right? Platelet function test is just really going to test for, like we do test for bleeding time, or we can test for